Hi, I'm Laura. I'm one of the nurses on the medical day unit at Toronto General Hospital, and I'm here to tell you why receiving a blood transfusion, if you're a sickle cell patient, partial manual exchanges are very important. The first step is we remove blood from the patient. The reason why we remove it is because the blood cells get clumped and stuck together with sickle cell. So they change shape, they clump together. So we remove the sickled blood, we give fluid, we remove another batch of sickled blood, and then we provide blood. The purpose of providing blood and why it helps so much is that when we remove the sickled cells, we replace them with brand new red blood cells, which help to bring oxygen to all the vital organs in the body, as well as it helps to prevent clotting of blood in the veins and arteries. Because the blood is fresh, it is matched to the patient, and it is very safe. A lot of patients have a great response to receiving the red blood cells after. They have more energy, they can breathe better, they have less pain crises during the month that we don't see them. So if you are a sickle cell patient and you're wondering about transfusions, they are safe and they're very helpful. Thank you. Have a great day.
I'm so grateful. I am so grateful because I always encourage parents that have children with sickle cell to take blood.
Yes.
And this explanation will go very far away to encourage parents that have children with sickle cell disease for them to take blood because it's safe.
Yes.
Right?
Some types of sickle cell disease, you're not required to do a blood transfusion. You only get phlebotomies, but speak to your physician, see what's right for you, and if you are eligible for red blood cells, it does really help.
God Almighty bless you for what you do.
Thank you.
Thank you so much.
Bye.